there are some areas that we really need to focus on, like we did not get any limited sick pay or paid leave for caregivers of people with disabilities, and we need to keep working on that. There's a lot more that came in the second package to help everyone, and some key pieces for people with disabilities as well. Really happy to say that money follows the person was extended. We wanted it to be permanent, but we did get an extension. The HUD and the ED funding is obviously going to be critical to our community as well. We did not succeed on 90-day refills for some specific medications that are often, needed in our population. So still working on that. And like I said, you'll get access to these slides, but definitely join Ellen tomorrow for a more full update on that and the advocacy that we need to do going forward with your Congress people. Okay, so now we're at the state summary level. And really, our state has been so busy. I know you guys have probably seen the governor and the Secretary of Health and Human Services on TV and doing their updates all the time. They have really been focused on stabilizing the service system across human services. Guidance has been coming out kind of every week. And what seems to be happening is guidance comes out, questions come out, and then guidance gets clarified. And then further guidance comes out. So that's kind of the cycle that we're in. And we did get some guidance from DDS, which I'll go into in another slide. We got some much clearer guidance from the Department of Education and Secondary Education. I'm sure many of you have followed both of these guidances that have come out. And our attention has been drawn to the issue of healthcare triage, inpatient care, and what they call rationing. And so we're going to talk a lot about that in another slide as well. And then some of the one of the biggest issues that seems to be coming up across the board for group homes, residential facilities, families, caregivers, and across the board, we need personal protective equipment. We did hear that Secretary Sutters was clear that personal protective equipment was on its way and would be fast-tracked to PCAs through Mass Health, yet we don't know when. So the need to continue to advocate for that is huge. So we'll get a little bit into DDS. So the guidance that came out has been really flexible, which is excellent during these extraordinary times. There's short-term emergency need funding, and that covers things like food and rental assistance and household costs and many other things. There's guidance for in-home care and using that flex funding for a variety of things. I would highly recommend that if your contacts at DDS haven't reached out to you, that you reach out to them. Reach out to your family support center. They're doing amazing work and they're there to help you. They just need to hear from you directly. And like I said, the flexibility seems to be there. So this is the time. We can come back with questions on more DDS guidance, but let's talk about a little bit about Mass Health, because we've had some good advocacy successes. PCA hours have been officially increased to vacation hours, which is good for some people, and others it doesn't really increase it very much. If you have the need for more PCA hours and you can fill those hours, I would really recommend reaching out to your PCA agency about that, because again, they're having flexibility around those. So even though the guidance says increase to vacation, definitely if you can fill those, talk to them directly. And up to 6 hours for adult day and day hab, which is helpful. As we know, our adults who are home really need that one-to-one time. Overtime has been approved again, so that's another win. And again, I mentioned PPE equipment for PCA was announced by Secretary Sutters. We are up and running on telehealth, which was, one of the ARC's first concerns about this crisis is really having the guidance for providers to get going on telehealth as soon as possible. We know that when our kids and loved ones get sick, they need to be seen right away. So this getting telehealth up quickly was super important, and they're doing a great job with that. If you're having problems with your provider getting up on telehealth, if you could reach out to the ARC, we really need to know that. And if you can't fill your, yes,
Terry, and if there's some specific telehealth barriers, Autism Insurance Resource Center is happy to help as well, help families navigate to get telehealth services.
Oh, awesome. Thank you, Terry. It's great. If you can't find a PCA, this is, probably what a lot of people are going through right now, including myself. You may have the hours, but maybe no one's willing to come in, or you're not willing to take that risk, which is kind of where I am. And if you are and you need a PCA more than anything, and maybe you feel okay about the risk, or you have some personal protective equipment and you just can't find a PCA, they have approved home health care agencies to do PCA work, and those people are available. So reach out if that's something, that could work for you. But the supports from Mass Health are definitely being looked at on a case-by-case basis. So don't wait to advocate. We've made some headway on the prescription refills. I think people are getting most of their prescriptions except for the psychotropic and some of the epilepsy medications. They're doing a whole lot of renewals telephonically. They're not doing any home, evaluations at this time. And they're trying to ease some of the red tape. Certainly, they've brought on more and more people onto Mass Health in general, which is great. But there are some areas that we could still use your voice on. I know so many of us are home saying, I'm doing all the care for my loved one, but as the guardian, I can't be the PCA. And so this needs to be a big push for all of us to say, at least at this time, let's get it into the waiver that guardians can act as PCAs during this crisis. And I encourage you to come to us with other ideas and thoughts, thinking out of the box as to what can help at this time. We're all trying to think that way and figure out a way to get help in the home, to get telehealth consults in the home, but we'll take absolutely any ideas and suggestions. Okay, so I wanted to talk about this really difficult subject of healthcare rationing and what's happening here in Massachusetts and across the nation. So, I think that it's kind of a hard concept for people to even wrap their head around, that the bias and discrimination against people with intellectual and developmental disabilities is still a real thing in the healthcare community. And during this crisis, what we've seen is states putting together provisions in the law and guidance for their hospital systems around how to ration care. And I'll give you an example. I think it's Alabama has said that people with intellectual disability should be deprioritized for ventilators in very clear guidance. There are other states that are also rationing care based on disability. And we are on this. The ARC has joined the Center for Public Representation and others. And we've sent letters to the governor and the Secretary of Health and Human Services. We have reached out to children, families, and persons with disabilities chairs and our chairs of our public health committees. We have heard that Massachusetts is not going to ration care, but what we would really love to see is very clear guidance around that for our hospital systems across the state. And for us to make enough communication out there about this, that no hospital system is going to make individual decisions that would be discriminatory. So that's a big issue we could use your help with. Talk to your legislators, share our media around this, and we're hopefully going to get some media stories to cover this soon. We know that bias exists. That's the whole reason why Operation House Call exists, is to try to get to the implicit bias that happens in the medical community. But this really made us think about the problems that we already have exacerbated by this crisis. And we're also trying to communicate that not only do we need to be treated equitably, but that we really may struggle with triage and with inpatient care in terms of behaviors and in terms of the comorbidities that come with intellectual and developmental disabilities across the board. So that's a big subject and a real important one to stay on top of. So stay following the ARC on this and our other partners. I put the link to the Center for Public Representation because they just put a really great summary up there of all that's going on. And I believe it has a link to our letters as well.
Maura?
Yes.
This is Mike Maloney. So we serve over 100 people in group homes. The surge will happen in 2 or 3 weeks.
Right.
Because we have highly mobile and itinerant staff who work in different group homes, we're expecting positive cases. And we're developing an isolation center, for example, if people can't be safely quarantined at home.
Right.
Given that we only have a few weeks before the surge happens, there is urgent need for some guidance, but I also wonder at the Center for Public Representation, or DLC, if there is a hotline or a number to call if you suspect that a person that you support is not getting equitable treatment.
That's a great idea, Mike, and I will find out for you and I'll share that. At this point, I don't think there is anything set up. This certainly came on kind of quickly in the last 2 weeks that we've been working on this, but that would be a great idea. The thing we don't want to do is make assumptions, about our health and human service leaders, because we know that they have, no intentions of this type of rationing happening. I just think we want to be very clear in the guidance that comes out. And I think we have to really make it widely known. So there'll be a lot of need to get it out there into the public and, stay with us. But I really am concerned about the group homes and how to keep people safe and how to keep staff safe. So let's keep going, because I'm sure I'm going to run over if I don't.
Maura, I was just going to quickly dispute it. HHS has put out some bulletins and information about this. So Mike, if you need to file a complaint or let someone know, they're giving strong directives that you cannot ration or discriminate against people with disabilities. I agree there needs to be ongoing advocacy about this, but this is just information about what's being said federally if you want to know.
Definitely. And besides the guidance that they're saying, what we're also concerned about is that their emergency plan. So what's happening across the nation is emergency plans or provisions are coming out. And this is where it needs to be very explicitly detailed, that there's no rationing going on. And it's great that we have an overall statement about it, and hopefully we can have a hotline. But our PrEP plan, or PREP plan for this also needs to be really explicit. So just have to stay on top of that. And thanks, Judith. Maybe you can share that link on chat.
Yeah, I stuck a couple of links on the chat.
Okay, thank you. Thank you. Okay, so some of the other areas of focus, and again, this is tough. Keeping individuals and staff safe in residential. And as Mike said, with the increase coming in the next couple of weeks, we're all really concerned. I mean, I think all of you know, social distancing is not an easy thing to do with our population. Sometimes hygiene is hard enough, and then wearing masks, if someone is sick, it could be impossible. So I think it's important that our legislators understand those idiosyncrasies of our community, and that we do have plans. I know, like Mike said, across the state, providers are meeting now to really come up with explicit plans on how to keep individuals safe as the crisis worsens. And we saw what happened at the Holyoke Veterans Home, and we know that close quarters like that is incredibly risky. So beyond that, trying to, while people are at group homes and while staff are taking care of them, we really need to address their emotional and mental health needs, and families at home who are either separated from their loved ones, or they're home for the first time with 24/7 first time with their loved ones. So these are all huge areas that need some focus. We have a lot, we know we have over 9,000 aging caregivers at home. So think of the risk for them of taking care of their sons and daughters, and having the aging risk. We're hearing a lot from families who have people with high acuity or medically complex at home, and they're feeling like whether they're school age or adults, there really isn't a intervention other than one-to-one hands-on interventions that are really going to help their family get through this crisis. So we need to figure out ways to provide supports for this kind of smaller but high need population. And all adult homes, from day programs, families are not used to this. It's 24/7 caregiving, similar to the parents of school age, and we're acting as nurses and behavior specialists, and many of us are trying to juggle work from home with the anxiety of this crisis. So everyone is going through this, and our community has these incredible additional challenges. The other challenging population are those who can live independently or semi-independently, and they're getting remote monitoring. They are facing more isolation than ever. And lastly, the threat to our workforce, and this amazing DSP workforce that is staying active out there, that has been on the front lines, that is in many cases now quarantined. How do we take care of them, and how do we keep them or get them back in the future? So these are all huge areas of focus that we're paying attention to. We're working with our partners, and we need your ideas and help with all of those. One way I think that's really important for everybody is to reach out to your rep and senator now. I think some people felt like, well, everything's kind of happening on the federal level, and my rep and senator are not in the office anymore, but they are working, and they have to hear from us because they're hearing from their entire community. I know many of them are collecting surveys, and they want to hear from you, and they want to hear what is high priority so they can bring this to their sessions when they're looking at passing legislation related to COVID. So educate them and connect now. They are holding sessions, they are passing legislation, they're trying to figure out what's really constitutional when so many people are not present, but they're still moving forward. So reach out and let them know what your needs are personally from your family, of course. And then keep in mind the needs of the greater community with PPE, the triage issue. Parents as guardians is a great thing to bring up. It makes so much sense. Supporting our aging caregivers and our high acuity population. So I thought I would just quickly mention, I know Carrie talked about the survey yesterday and Leo probably mentioned it as well on Monday, but we're gonna close it next week. So I wanted to direct everybody who hasn't shared it or taken the survey to go ahead and do so. We have already addressed many of the priority issues that have come up on this survey, and we're working on action plans for the others. What's been really helpful is some of the comments that have come in, because that helps us identify the outlier issues and some of the really high priority or dangerous situations that are going on for families. But as you can see, behavior challenges and structure and medication, I get those. So that's what I'm living to. So we'll be analyzing this survey and trying to get those results back to you with how we've addressed some of these and what we still need to work on and what we are working on and making progress on. I left this slide in from Leo's presentation because I just wanted to say to all the caregivers out there, you know, this is how we were, you know, last year when we were doing our advocacy around family support and around the workforce. And we were extremely stressed. We were skipping medical appointments. We were going without dental care. We were not getting tests done. We were having to leave work early. So if you think about where caregivers are to start with, and then these additional challenges around this crisis, please, I just want us to do our best to take care of ourselves. If you're a professional, to really make sure that the caregivers are getting what they need, getting some rest, getting some psychological and emotional support. So wherever we can remember that, they're gonna be the ones who have to stay strong through this whole crisis. And I think I'm probably up for time, so I can open it up to questions. I did put the We Are Essential hashtag on here because this is the ARC US's campaign. And I would say any advocacy that you're doing, go ahead and follow the ARC US. They're doing an amazing job on a federal level. And I think this hashtag says it all.
Okay, thanks, Maura. We do have a couple of questions that's come in on chat. Nancy had a question about hospitalizations and parents and caregivers not being allowed to be with their loved ones. Can you address that in any way, or?
Yeah, sorry. So I think there's confusion around that for sure, and I'm pretty certain that some hospitals will allow it and maybe others won't. We found some different, contrasting information around this. So it's definitely an area that we need to get a clearer understanding of. So I was thinking, personally, if I know a hospital that I'm probably gonna go to if my kid gets sick, I wanna get in touch with those people beforehand to find out their policy. And, we can definitely try to get a more state policy that comes down on it. But I think in general, people need to connect with their healthcare facilities, with their pediatricians or primary care doctors to get them that information.
Okay, thank you. And then Judy had a question. Also, parents with kids in residential, but who took them home, are wondering if they could get PCA hours quicker than usual or AFC.
Yeah, so I think that they're the gap, the people that fall into the gap if they're resi and then they come home. I would say absolutely contact the PCA, Mass Health, and the PCA agency that maybe supported them before, or I think this is the time to do that. I know personally my son did get PCA hours even though he was residential and I brought him home.
Okay, great. I heard, I was reading yesterday, this is Carrie, about a situation where a family, she's an essential care employee, and so she does have a PCA in place, and requested time, overtime hours, and it was denied.
Oh, no.
So I just wanted to bring that up, that I think that's something we need to jump on, what the process is on that sort of thing. So.
Absolutely. I mean, I really want to use these webinars and forums to catch those problems, because, we have a great direct line to Mass Health and to DDS. So let us know when things aren't going right or when you're overwhelmed.
Yeah, Judy made a comment about that. It does seem like Mass Health seems to be, do an automatic denial first. Then you have to fight it. But I mean, this is in this situation, it just where they've made a statement that they will allow overtime. Just wondering what we can, we need to kind of communicate that with Medicaid.
It's definitely in their policy, right? So it's in the written policy that came out last week.
Yep. Yep.
Hi,
All right.
Maura, this is Terry, and I have a call later this afternoon with the folks at Mass Health, and I will bring this up.
Oh, great.
Thank you.
And if there's a specific procedure that families can follow, they are working diligently to try to get families to access as many services as possible. So, but if I get any guidance, I'll share that with you, Maura.
Thank you so much.
All right. How about anybody else? Anybody, you could either chat in or unmute yourself and ask a question. Okay. Let's see.
Can I jump in, Chris Hubbard here?
Hi, Chris.
Sure.
I wondered, going forward, when the new tests that don't require the swab way up the nose at the, there's supposed to be a new one coming on that be right at the nostril, if there's some way that those could be directed to people who can't tolerate the swab. We're in a situation in my son's group home where the test results for one of the residents came back inconclusive because they just couldn't get a test, and I can completely understand that. So you end up having to treat it as, assumption that it's a positive COVID test. So I don't know when those tests become, I know they're not really available really right now. I think it's the Abbott test, but when they become available, if some Mass Health could give some consideration to those that can't tolerate that kind of a test.
Absolutely, Chris. I think, like I mentioned earlier, I know the ARC providers are really coming together around what are the specific needs of the population that's now in residential as this virus increases. And so if we can use that information in our communication, that'll be super. So I'll definitely put that down. Thank you.
Okay, great.
Thanks.
Yeah.
Anyone else? Well, I know we said that this would be a half an hour, but lots of good information, lots of great comments and suggestions. So I think I don't see any more questions. Okay, here's one. Are there directives that speak to PCA hours that are not being used at this time due to not being able to find someone being banked?
Mm-hmm. Well, I'd like to get clarification on that, because typically those hours should be able to be used, if, especially in a situation like this, in terms of being banked. But let's find out specifically, because can we get an email and get that answered?
Yeah, I'll put something out to everybody who attended the call today.
Okay.
Yeah, because, she was saying that some of her families can't get someone to come in the house.
Yeah, and I'm in the same boat. And one of the things we did see is there a reminder that family members can be PCAs, not the guardian. So if that's an option for anyone during this time, I'd say that's a good option since family members are doing it all right now.
Yep. Also, we are going to be providing everybody with a copy of today's PowerPoint. So no worries. I'll send this out after the session.
Well, I really praying and sending best wishes for everybody to stay healthy and to manage through this and stay connected. And we'll see you probably in a week.
Okay, thanks, Maura. Thanks all for joining us. At the end of the session, you all are going to be all rerouted to a brief survey on your webinar experience. So if you could fill that out, it's really appreciated. And also, if you have any ideas on what else you would like information on. So lots of thanks from people, Maura. So, okay.
Thank you, everyone.
Thanks, Maura.
Thank you. Take
Stay
care.
well.
Bye-bye.